Nausea and vomiting. Causes, care, and when to worry. Have you ever felt that sudden wave in your stomach? That uneasy, rolling sensation that makes you pause, breathe slowly, and wonder, am I about to be sick? Nausea and vomiting are some of the most common symptoms the human body experiences. They can come suddenly, disappear just as quickly, or sometimes linger and drain your energy. Today, we'll calmly walk through what nausea really is, why it happens, how to care for it at home, and, most importantly, when your body is asking for medical help. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. What is nausea? Nausea is the uncomfortable feeling of wanting to vomit. Vomiting, on the other hand, is the act of being sick, throwing up. You can feel nauseous without ever vomiting. And sometimes, even after vomiting, that sick feeling stubbornly stays. Almost everyone experiences nausea at least once in their lifetime. It's not a disease by itself. It's a signal from your body that something isn't quite right. What causes nausea and vomiting? There are many possible causes, ranging from harmless to serious. The most common causes are short-term and self-limiting. Stomach infections, also called gastroenteritis, are one of the biggest culprits. They often cause vomiting and diarrhea and usually settle within a couple of days. Food poisoning can trigger sudden nausea and vomiting after eating contaminated food. Alcohol irritates the stomach lining and can easily cause vomiting, especially in excess. Cannabis use, particularly long-term use, can paradoxically lead to repeated nausea and vomiting. Pregnancy is a very common cause, especially in early months, due to hormonal changes. Migraines can strongly affect the brain's vomiting center, causing nausea even without a headache. Some people feel nauseous before their period as part of premenstrual syndrome. Inner ear problems, such as vestibular neuritis or Meniere's disease, can disrupt balance and trigger nausea. Motion sickness happens when the eyes and inner ear send conflicting signals to the brain. Certain medications, including chemotherapy, antibiotics, and strong painkillers, commonly cause nausea. Urinary tract infections, especially in older adults, can present with nausea rather than urinary symptoms. Eating disorders like bulimia nervosa involve repeated vomiting and serious complications. Stomach-related causes. Acid reflux, also called GORD, occurs when stomach acid flows back into the food pipe, causing burning, discomfort, and nausea. Stomach ulcers can cause severe pain, poor appetite, and sometimes vomiting blood. Gastroparesis, where the stomach empties slowly, causes nausea after eating. This is more common in diabetes, Parkinson's disease, and after weight loss surgery. In babies, pyloric stenosis causes forceful vomiting and needs urgent treatment. Metabolic and medical causes. Poorly controlled diabetes can lead to diabetic ketoacidosis, a dangerous condition with persistent vomiting. Addison's disease develops slowly and causes nausea, along with fatigue, weight loss, and low blood pressure. High calcium levels in the blood can trigger nausea and are sometimes linked to gland disorders or cancer. Other serious causes. Appendicitis, pancreatitis, gallstones, kidney stones, and severe ulcers often cause intense abdominal pain with nausea and vomiting. A blockage in the gut causes repeated vomiting, severe pain, and inability to pass stools. This is a medical emergency. Raised pressure in the brain, due to meningitis, head injury, or brain tumors, can cause vomiting and confusion. Liver disease may cause nausea, along with yellowing of the skin and eyes. Advanced kidney disease can also trigger persistent nausea. Acute versus persistent nausea and vomiting. Acute nausea and vomiting last less than 24 to 48 hours. They are usually caused by infections or food poisoning and often settle on their own. Persistent nausea and vomiting last longer than 48 hours. As time passes, simple causes become less likely and more serious conditions need to be ruled out. What your doctor will want to know. Your doctor will ask detailed questions. When did it start? Did it come on suddenly or gradually? Is it triggered by movement or eating? Is there fever, pain, weight loss, headache, or confusion? Have you noticed blood or bile in vomit? Could pregnancy be possible? Have you started new medications? How much alcohol do you drink? These answers help identify dangerous warning signs. What to do to help nausea and vomiting. If vomiting is severe, with weakness or intense abdominal pain, call urgent medical services. If symptoms last more than 48 hours or worsen, see a doctor. Prevent dehydration by drinking small sips frequently. Oral rehydration solutions can be very helpful. If food worsens nausea, it's okay to pause solids briefly. When eating, choose plain foods and avoid strong smells. For motion sickness, fresh air helps. Sit facing forward, close your eyes, avoid reading, and focus on a fixed point ahead. Red flag symptoms. You must not ignore vomiting blood or green bile. Unexplained weight loss, severe abdominal pain, high fever, neck stiffness, rash, or light sensitivity, increasing weakness, confusion, or loss of consciousness, vomiting that continues or worsens after 48 hours. Seek urgent medical care if these appear. Problems caused by persistent nausea. Long-lasting nausea, such as in pregnancy or chemotherapy, can be emotionally exhausting and deeply distressing. Many people find constant nausea harder to tolerate than vomiting itself. Problems caused by persistent nausea. Repeated vomiting can cause dehydration, especially in babies and young children. Loss of essential salts like sodium and potassium can disturb heart rhythm and cause serious complications. Frequent vomiting damages teeth, irritates the throat, and can cause bleeding tears in the food pipe. Vomiting while unconscious is extremely dangerous and can lead to choking or lung inflammation. Frequently asked questions. Morning nausea may be caused by low blood sugar, dehydration, acid reflux, anxiety, medications, or pregnancy. Constipation can cause nausea by slowing digestion and increasing stomach pressure. Anxiety triggers stress hormones that affect digestion, leading to nausea. Nausea after eating can result from overeating, fatty foods, reflux, infections, or food intolerances. Vomiting may bring relief because it removes irritants and reduces stomach pressure. Final takeaway. Nausea and vomiting are common and often harmless, but persistence, severity, or warning signs should never be ignored. Listen to your body, respect its signals, and seek help when something doesn't feel right. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.